welcome to Ron's Teachable Talks. We have a really interesting topic today. I think you'll all really enjoy and find it fascinating. Ron, you ready for our question today?
I'm ready.
Awesome. So, what would you say for someone that has already been through surgery and has still, maybe over the next coming months, while afterwards, they're still dealing with pain and maybe some still limited function of whatever, maybe it was a back surgery, knee surgery, and there's still limited function of that area. What do you do to help people like that are still experiencing that type of pain after the surgery has already happened?
Okay, yeah. What we do is, with those patients, we do a directional preference evaluation where we do repeated movements in different directions to try to determine which direction the patient should move in. I had a interesting case a couple of years ago that really illustrates this point. This gentleman came to me for back problems, and he was having difficulty walking because of back problems. And he's a young guy, only 45. And he, we did the back exercises, and he actually got better very quick with the back exercise. And he started walking, he was feeling better. But then he said, as he tried to walk farther, his knees were bothering him. And we talked about his knee history, and it come to find out he had had 4 surgeries on his knees, 2 on both knees. So that's a lot of work on your knee. And I'm thinking, I don't know if we can do anything for this gentleman. However, we started working on his knee problems, and with the directional preference exercises, he was able to improve his walking significantly by following both the back exercises and the new knee exercises. And so here's somebody with 4 knee surgeries that he was just happy to be kind of walking again because of his back, but he now can walk a lot farther than before the back problem, even because he's not as limited by his knees as he was in the past. So he was really a big success story from 2 perspectives, both the back and the knee.
It's really funny. A lot of people, they tell you about what's going on, and you find out the whole story. Because there's more that lies beyond what's happening to them in that current moment. And you, like you said, you found out he had 4 different surgeries on his knees, and that I could see why that might have been causing some of the problems there. So it's great that you've been able to figure out, what was going on there. Do you have another back example? I know there has been treatments about, burning the nerves to the joints in the back. Maybe you can explain a little bit about what that means, because some people might have questions about that. They might have heard that.
Yeah. Yeah. So a lot of times, if patients, they've been to, let's say they've gone to therapy and they didn't get better. And then they go to the doctor and they say, well, let's try an injection, steroid injection.
Yeah.
And maybe they try that a few times, and maybe it worked a little bit, but it's not really working well after a while. The next step, they might be asked, would you like to have a nerve ablation? It's called radio frequency nerve ablation. In essence, it's burning the nerve that goes to the joint in the back. However, it only lasts for 4 to 6 months usually. Then the nerve grows back, and then they have the pain again. Then they have to have it done again. It's an invasive procedure, Sounds pretty terrible, burning of the nerve, right?
Sounds terrible. Yeah.
And so, well, I had a couple of patients that I can tell you about. The first one was a woman who had back surgery maybe 10 years prior, but then the pain came back and she started going for these ablations like a couple times a year, 2, 3 times a year. And they were sort of fading out a little bit. They weren't doing as well. And the doctor suggested she go to see a surgeon, that she needs back surgery again. The surgeon happens to be a doctor I know who is very conservative. So he sent her over to me. And we tried various McKenzie type exercises and directional preference. And she started getting better and better. And she was able to completely forego the surgery. And she told me later that she went on a trip with her family to Europe for 2 weeks and did extremely well just by doing the exercises while she was on vacation. So that went well for her. The other one was a lady who had been doing sort of a similar kind of thing. She had a long history of back problems, was getting these, the ablations, the nerve ablations. And again, she was hoping to maybe not have to do those anymore. And her doctor referred her to me. And we, again, did a directional preference evaluation. We found an exercise that really, really helped her a lot. And when it was time, she was getting a call from the office that does the injection saying, it's about time for your injection. You haven't called us. She says, well, I don't think I'm going to need it. I'm getting relief with the exercises from the physical therapist. And so she hasn't needed to do that anymore. So we like to get those patients before they go to the pain management doctors and see if we can maybe do something. If we can't, if we don't have any result, then that would be the next appropriate step. But a lot of times they go there before they get to us. And we'd like to reverse that process if we could.
100%. And I think for the people listening, they're thinking physical therapy or nerve ablation, getting my nerve burned. What would you rather do, people? And so I think we all know what the answer is. But Ron, I really appreciate you going through these examples and explaining, because not everyone might know what all these things are that people are doing to treat that pain, and when that can be far less invasive and take far less time. You just never know. So I would say pay Ron a visit. And Ron, this was a wonderful Teachable Talk. Thank you.